Good afternoon. I'm Mandy Cohen. I'm the Secretary of Health and Human Services for North Carolina. Thanks for joining us this afternoon. I'm joined by Director Sprayberry, as well as Brian Tipton and Nicole Fox doing our American Sign Language interpreters, and working behind the scenes are our Spanish interpreters, the sisters Jackie and Jasmine Matevier. So I'm going to start with a rundown of the numbers, and I'll turn it over to Director Sprayberry. As of this morning, 89 counties in North Carolina have COVID-19 cases. We have 2,870 cases now in North Carolina. That's up about 800 since just Friday. Of these cases, 8% of them are ages 18 to 24, 48% are ages 25 to 49, 28% are 50 to 64, and 21% are over the age of 65. We currently have 270 people hospitalized. This is up another 11 since Friday. And sadly, we've had 33 deaths. That's another 14 people since Friday that we've lost. Obviously, our hearts are with those families at this time. We've done more than 40,000 tests that have now been completed across labs, from the state lab to private labs to our academic partners. They have reported those as negative tests, though not all do report. In addition to these numbers, this morning, a collaborative of North Carolina data experts from the private and public sectors released a North Carolina-specific modeling forecast, looking at how COVID-19 could affect our state in the coming months. The model reinforced the things we're already doing, the need for social distancing to slow the spread of COVID-19 and ensure that hospital care is there for the people who need it. The team found that the social distancing policies we currently have in place in North Carolina will help lower the likelihood that we'll overload our healthcare system. That's good news. On the flip side, they found that if we ended those social distancing efforts at the end of April, it could lead to a greater than 50% probability that we will outstrip our acute care and ICU bed capability, possibly as soon as Memorial Day. They also found that if social distancing was to stop at the end of April, roughly 750,000 North Carolinians could be infected by June 1st, as opposed to around 250,000 if some form of effective social distancing remains in place. Social distancing flattens the curve so that fewer people get sick at the same time. We know when people aren't coming into contact with each other, it lowers the chance that they will either catch or pass on the virus. So that was a lot of news this morning, and I'm sure we'll answer your questions about that. We also heard over the weekend about face coverings and what role they play in slowing the spread of the virus. First, I want to note that face coverings are not the same thing as the face masks that are needed by our healthcare providers and first responders. The Centers for Disease Control updated its guidance over the weekend and recommends wearing a cloth face covering in public settings where other social distancing measures are difficult to maintain, such as in grocery stores or in pharmacies. They are not recommending medical face masks. Our supplies of face masks need to go first to those on the front lines. Our healthcare workers need protection. But for the rest of us, cloth coverings can play a role in controlling the spread if they are used properly and in combination with other tried and true things like washing your hands, wiping down surfaces. If used incorrectly, face coverings can expose someone to more germs rather than less. The very best evidence on reducing the spread of the virus is to social distance and stay home. So please help us to continue to save lives by staying home. I'm going to turn it over to Director Sprayberry, and then we'll take your questions.
Thank you, Dr. Cohen. Good afternoon. Today is day 28 of the State Emergency Operations Center activation for the COVID-19 response. 64 counties have activated their local emergency operations centers. 99 counties in the eastern band of the Cherokee Indians have declared states of emergency. National Guard planners will begin to deploy later this week to help with advanced planning at 10 county emergency operations centers with our local partners. We're continuing to plan and prepare for medical surge, to have enough facilities and beds available for when the hospitals are filled. The U.S. Army Corps of Engineers and engineers from the National Guard have conducted many facility assessments across the state to find locations that are suitable for patient housing and for alternative hospital space. Our mission to find and obtain supplies continues. On Friday, we received a shipment of more than 600,000 surgical masks from a private vendor. That's in addition to the 598,000 surgical masks we've gotten from the national stockpile. Of all the hard-to-get personal protective items we're seeking, surgical masks are one item where we have had some success. But we still need more of all types of personal protective equipment. Once again, I want to remind everybody that 911 is for emergency calls only. Please refrain from calling to report stay-at-home or social distancing violations. We need to keep 911 lines open for true emergencies. Enforcement of stay-at-home is up to local law enforcement and is being handled differently depending on where you live. Check your local government website. Some counties have stay-at-home hotlines where you can call with questions or send an email with a question. If everyone does their best to stay at home and observe social distance, these calls will not be necessary. 211 is taking thousands of calls daily from people who need information or help with resources like food, utilities, child care, and other needs. If you call and get a fast busy signal, it means that all incoming lines are tied up with other callers. Wait an hour or so and try your call again. For twice daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. That's 898-211. You can get text in either English or Spanish. In order to save lives and keep people healthy, we need everyone to stay at home and stay distanced to stop the spread. Think about your loved ones who are elderly or in poor health. They are the ones you are putting at risk by ignoring the guidance and not staying home. Thank you for your support of the State Emergency Response Team. Don't forget to call your loved ones daily. With your help, we will get through this together as one team, one mission, one family. Thank you, and I'm turning it back over to Dr. Cohen at this time.
Thank you so much, Director Sprayberry, and now we'll